was clearly self-evident. There's one other key thing.
When you say back when was back when?
This was fall of 2021, as I recall.
Okay, so again, I'm talking to people in fall of 20.
Yeah, so that's based,
I mean, beside themselves, actually, that his colleagues would have done something like this.
So the use of the spike protein was based on the use of it in preceding vaccine development efforts for MERS and SARS-1.
Okay. Dr. McCullough.
I want to make the point that Ralph Barrick at University of North Carolina, Chapel Hill, published in 1992 that beta coronaviruses given in high doses to animals would cause myocarditis. And the pathogenic mechanism was the spike protein. What I'm seeing clinically is now patients have taken the vaccine and they've had COVID and they've taken the vaccine and now it's all mixed and there's multiple exposures. The more exposures there are, in my estimation, there's greater risks of myocarditis and recurrent myocarditis and blood clots and more blood clots. And the FDA and the manufacturers strictly excluded COVID-recovered patients from the clinical trials because of that fact. And so to allow them and then ultimately mandate them, people who have recovered from COVID, to take the vaccines, we've compounded these side effects greatly.
So again, I'm just trying to describe this in layman's terms, okay? So the vaccine attaches to, for example, the heart cell, and now the body's attacking it. That would cause the inflammation, correct? Is that what caused the myocarditis?
It's not just one thing. I mean, it is toxin. It's a toxin in multiple. It goes through different receptors. It does it directly. It causes it different cells. The gatekeeper for everything is really the endothelial cell. It starts a whole cascade of inflammation that brings in white cells, a mixed variety. So what we see in autopsy, we're seeing neutrophils where we would expect only to see lymphocytes. I know this is very complex, but that's what we see. It's a mixed picture. So everything is getting inflamed. And we don't know why one person gets it over another, but way too many people are getting this. We don't see this with the flu vaccine. We don't see anything like this with the flu vaccine.
It's because it's...
again, the fact that mRNA, the synthetic, it's knocked around the body for quite some time. I mean, could it enter cells or is it inert?
Can I reframe this just a little bit? And yes, it appears to be very long-lived. The paper that I'd like to cite in that context and about what I'm going to say has a first author of Roltgen. It was published in Cell, January 24th, 2022, from a group at Stanford, a fairly large group. So this is the premier journal in one of the premier labs. And this is not cell culture based or hypothetical animal research. This is drawing blood and sampling lymph nodes from humans that have received the vaccine. One of the key criticisms that folks make, physicians, is, well, the virus causes myocarditis. The virus expresses spike protein. What's the difference between the virus and the vaccine? Why should we be seeing more of these problems with the vaccine? As was mentioned by Dr. Lindsay earlier, the pharmacokinetics and the pharmacodistribution studies were not done. Where it goes, how long it lasts, how much. But this paper that finally came out, January 24th, 2022, clearly demonstrates that the level of spike protein produced from the vaccine is significantly higher than the levels that are observed with the natural infection. Furthermore, as Peter has spoken about mucosal immunology, in the normal infection process of the nasopharynx, your face, when you get infected, you have this infection starts gradually. You have more and more spike gradually building up as the immune system kicks in and controls it. In the case, so you have a curve that kind of goes like that. In the case of the vaccine, you have a curve that goes like this. You get a whole lot of protein produced circulating in the body, and then it gradually tapers. It's very different, and it's very much more. So when you see these stains that Ryan's showing you, one of the things they reflect is the levels of spike protein, and spike is a toxin, are significantly higher with the vaccine product than they are with the infection. Over.
So let me quick ask you, why did the regulators in Denmark and where else did they, where's the other country? UK. No, I mean, they actually stopped administering it to people under 30 and under 50. Which two countries are that? Germany. So what were they seeing in the data?
Too much harm.
Just
Too much harm. And
just what Ed Dowd was talking about.
The Moderna, they saw dose response. If you think about it, it has 3 times as much genetic material in it as we think. That's what it's described as.
Because I was going to next go to the Moderna with 100 milliliters versus Pfizer with 30.
Yeah, well, we see
Are we
it.
seeing a difference there clinically?
We see it consistently in myocarditis data that it's almost always 3 times as much. And then, but what also is concerning in the Scandinavian data, which I was sharing with you, is that when you start mixing them, that even went higher. So if you give we're going to give 2, you're going to get Pfizer and then a Moderna or something like that. That data was more concerning. The odds ratios were higher in those. So,
and it's important to note that that was a seminal paper by Dr. Roltgen from Stanford. The real question to ask is, when does the body with the synthetic RNA stop making spike protein, and when is it eventually fully dissolved? And the answer is, we don't know.
So again,
I don't know
that was one of my points at the onset.
Nobody has that.
There's so much we don't know. And when you don't know a whole lot, don't you exercise some caution? To me, that seems the most, the egregious problem here is the fact that they didn't use caution. They were just, the hubris was grotesque here.
Senator, if I could add something very briefly. I know we're running short on time, but I did notice that there actually is, despite what Dr. Mooney said, there is actually a label online for this drug now, but it was released in July of this year. But but of course the majority of the doses that were given by healthcare practitioners were given away before there was ever a package insert. And then it does have a warning in there for myocarditis, but there's nothing in there where it says it's temporally related, saying, because we haven't characterized the half-life. And I have a question for Dr. Malone about the same in just a moment. But normally, if there were a warning, it should say, do not exercise for, and then they would insert a period of time, insert a half-life. But so Robert, is there a way to calculate the half-life of gene therapy or not? Or is it permanently embedded?
As Dr. Cole was mentioning, this Rolkin paper tested the longevity of the RNA in lymph node biopsies from vaccine recipients in the deltoids. So the jab goes here, they put a fine needle in the lymph nodes there, they draw out some cells, they say, is there RNA? They test for 60 days. The RNA signal is still detected at 60 days. They didn't test longer than that. Clearly the RNA signal drops significantly during those 60 days. Those are the data. So that demonstrates that, yes, sir, if this study was done as a pharmacokinetic study using this technology and these methods, one could derive the half-life for both the expressed spike protein in the circulation, as these investigators did, and could derive the half-life of the synthetic RNA.
But is that the immunologic data for 60 days, or like the presence of the spike?
This is persistent mRNA and persistent spike protein.
So
Thank you.
Dr. Moon, real quick.
Thank you. As a pediatrician, I have to speak to the health of our nation's children. And we are being asked to inject this product into our nation's kids who have essentially a 0% risk of harm. When I bring up with families that other reputable countries have banned this, they're stunned. They haven't heard this from our mainstream media. And I do think we need to pause for a second and just stress how relevant that is. Other nations have banned this product because it's too dangerous for younger people. What are we doing?
Well, let's face it, the main reason, we talked about this yesterday, that the main reason for this event today was, first of all, to provide information that the American public deserves to know, that they're not being told, but anything we could do to prevent further harm. I mean, it's just that simple. I'm sitting here going, I don't want to scare the you-know-what out of people. I don't. None of us do, okay? But they need to have that information. Dr. Thorpe.
I just wanted to point out how important I think that comments are. Birth rates all over the world are plummeting, to her point. The other point with regard to the confusion and the masquerading, if you will, of the vaccine effects from COVID-19 itself, I can assure you that in my experience, it didn't happen, and I can show you data. In 2020, when we had the massive assault with COVID-19, we didn't have an increase in stillbirth. That stillbirth rate actually dropped down to 5.73 from about 5.83 per thousand births, which was the aggregate of the 3 prior years.
So again, in your field, you didn't see that impact in terms of health outcomes from COVID from the disease. Only till the vaccine was rolled out.
That's correct. In 2020, the massive assault of COVID-19 and everybody, including my pregnant woman, I did not see this rise. The rise was not seen until after the vaccine. And I have vital statistics of our national vital statistics to prove that.
Sir,
Yeah.
I would like to make this point for anyone who is considering getting their children vaccinated. We've had a hard lesson learned. We've had soldiers who have gotten vaccinated, who've been destroyed. You've heard victims up here who've been destroyed by this vaccine. An EUA product means you have no legal recourse. You could give that vaccine to your child, they could drop dead the next day or end up in a wheelchair like Maddie Gray, and you have no ability to sue the pharmaceutical companies, just like my soldiers. They said it was FDA approved, yet they have not produced any FDA approved vaccines with corresponding lot numbers. And it is the lot number off of that vial. It doesn't matter if the EUA product and the FDA approved product have exactly the same ingredients in that vial. It is the lot number that corresponds to either an EUA product or an FDA approved product that gives you the ability to legal recourse. And once this vaccine was put on the childhood vaccine schedule, the pharmaceutical companies have complete and permanent indemnity from legal recourse should anything happen to you or your children. And our soldiers have been forced to take an EUA product, even though it is illegal to mandate service members be injected with an EUA product.
So we have 5 minutes left. I mean, what I really wanted to do in this segment, and I really don't think it's necessary, is I kind of wanted to explore the myocarditis, the clotting, what's happening in women's health, that type of thing. I think we kind of get the gist of why this could be a concern, okay? The other 2 points that we wanted to cover, and again, we don't really have time, but I'll just throw them out there for discussion, is the fact that we do need a pretty detailed list of what research needs to be done. I mean, we kind of talked about what should have been done and wasn't, but I mean, now at this point, moving forward, it's like there are things that we need to have the answers on, correct? I mean, there's research that needs to be done. There's data that the CDC, FDA, NIH should have been gathering that they ought to make transparent so that medical experts can kind of go through this and understand what may be happening here, okay? There's so much that we haven't talked about. Another, and then again, with what closing minutes we have here, we did also want to discuss what the plans are for the mRNA platform, because it's not just, they're not talking about just using it at one-time use here. They've got
salaries. We started off at $500 million. This year we'll have $1 billion in that teacher categorical program. Since we've already met our goal of